If you are wondering if your knee pain is because of osteoarthritis, then today's video is for you. Now, my disclaimer is you do need the expert wisdom of a healthcare professional to make the accurate diagnosis, but today I'll at least highlight the 5 things or common signs that I see with people that have knee osteoarthritis. Now, my name is Shehla Rooney, and I am a physical therapist and have been for over 26 years. I have a board certification in geriatric physical therapy. All that means is that I specialize in the older adult. And since osteoarthritis mainly affects people over the age of 50, it kind of makes me an expert. So let's first ask ourselves, what is osteoarthritis? Well, osteoarthritis, or OA as it can be called, is the most common form of arthritis. It is known as the wear and tear type of arthritis. Health professionals sometimes call it degenerative joint disease. And the general public, or some of my patients, have called it old Arthur. It's where the cartilage in your knee joint gradually over time wears away. As I mentioned, it predominantly affects people over the age of 50, but it also can affect younger patients as well. So, how do you know if you have knee osteoarthritis? Well, let's get into it and talk about the 5 most common signs and symptoms of knee osteoarthritis. The first one being persistent pain. This is the hallmark sign of knee OA. And the thing is, when did your pain start? How long have you been having this pain? When does the pain get worse throughout the day? The thing is, with osteoarthritic pain, it does not develop suddenly. So if you just started having knee pain a few weeks ago, it is very unlikely that it's related to osteoarthritis. Instead, osteoarthritic pain, it develops gradually over time. We're talking like over months and years, and it gradually worsens. It seems to be that your pain will worsen with activities that place additional stress on your knees, like weight-bearing activities, like prolonged standing, walking long distances, going up and down stairs, running. With osteoarthritic pain, they can tend to get better with rest. However, too much rest also causes pain, meaning if you're not active, if you've been riding in a car for hours, then also with osteoarthritis, that will make your knee pain worse. Also getting up in the morning when you've been lying in the bed all night and you haven't been moving your knee, that can also be an indicator of knee osteoarthritis, is waking up with a painful knee. All right, the second sign that you might have knee osteoarthritis is stiffness. So we talked about waking up in the morning with pain. A lot of times with that pain comes stiffness because your leg has not moved throughout the night, so it gets stiff. But usually my patients will say after they get up and they move around or take a hot shower that their knee stiffness starts to feel better. With osteoarthritis though, also by the end of the day, patients will report stiffness. It's one of those things where if you move too little, you'll have stiffness. If you move too much, you will have stiffness. It goes both ways. And by stiffness, I mean you might have difficulty bending your leg or straightening your leg. Patients tend to walk with a stiff leg. They'll notice they're limping. It's because of that stiffness, which is the second cardinal sign of knee osteoarthritis. All right, the third sign that you might have knee osteoarthritis is swelling. So sometimes patients will say, one knee looks a little bit bigger than the other. And this can be due to the formation of bone spurs. Health professionals call them osteophytes. It can also be due to maybe a collection of fluid around the knee joint, both of which can cause the knee to look swollen or puffy. And with this swelling, there can be associated warmth, so the joint feels a little warm or tender to touch, especially around the area around the joint that is enlarged. All normal with osteoarthritis. And just like with pain and with stiffness, it's one of those things where if you don't do a lot of activity, your knee might swell up. If you do too much that day, you might see some additional swelling. Okay, the fourth sign that you might have knee osteoarthritis is buckling of your knee or locking up of your knee. So as I mentioned previously, bone spurs or osteophytes can form around your knee joint. And what happens is as the cartilage deteriorates and this extra little bony areas form, instead of having a smooth surface to slide and glide around, it becomes bumpy and rough. And so sometimes you're moving your knee and something gets stuck and all of a sudden your knee is locked into that position. So some patients say it got stuck in a straight position, some say it got stuck in a bent position. But the point is, over time, this sticking of the uneven surfaces of your knee joint kind of makes your knee joint unstable, and it can lead to falls. I mean, if your leg buckles, like if it catches on a rough surface, there's pain associated with that. your knee will buckle and you'll have a fall. So you can see how that uneven surface constantly rubbing on each other causes a significant deterioration over your knee joint over time. It affects the ability to do everyday things like getting up from a chair, going up and down stairs, walking outside. And a big thing that affects my patients is fear, meaning once that leg locks up or buckles and gives out and they have a fall, now there's a fear associated with activities because you're like, what was I doing that caused that? And I want to make sure I don't do that. So this downward spiral of less and less activity starts to occur. So the fourth sign that you might have knee osteoarthritis is that your knee buckles or locks up. All right, the last and final symptom that you might have knee osteoarthritis is grinding and crackling of your knee joint. So patients will say, I go to stand up and I can feel it grinding and moving and popping. I can not only feel it, but I can hear it, that whole snap, crackle, pop, like the Rice Krispies thing. It tends to happen when they're transitioning, like going down a step, going up a step, getting up. The technical term for this is crepitus, and it is because of the things that we just talked about, which is that cartilage has worn away, so that surface is uneven and rough, and it's those bones rubbing together and grinding together that is causing that feeling of grinding and those audible sounds of cracking and popping. So the fifth sign that you have knee osteoarthritis is grinding and popping of your knee joint. All right, so next let's talk about what is the cause of osteoarthritis. Now, there are numerous causes, but for the purpose of this video and to keep it short, I'm going to talk about two categories of causes. Modifiable, which are things that you actually have the ability to change or control. So things like your weight, you have control over that. How strong your quadricep muscle is, which is the muscle on the front of your thigh, that's something you also have control over. You do have control over your occupation. If you're having to stand a lot during the day or stand on concrete, could you possibly modify your duties at work so that you don't aggravate your knees? That's a modifiable risk factor that can cause osteoarthritis. Maybe avoiding repetitive activities like high impact running, maybe slalom skiing, if you know what that is. And then also something that's modifiable is, making sure you're doing good injury prevention, a good warm up before doing activity or a cool down, stretching appropriately. Those are all modifiable risk factors that impact your ability that causes osteoarthritis. Now, on the flip side, there are some non-modifiable risk factors. For example, you can't control your age. I am what I am. You can't control your gender and your physiology makeup of what you were born with. Your ethnicity, it is what it is, your genetics and your family history. Some families just have a high incidence of arthritis, no matter what your size is or what your activity level is. Same thing, today I can't change the fact that I had a scooter accident in 1999, where I wrecked my knee. There's nothing I can do about that today. So it's not something that I can modify. So that's a non-modifiable risk factor. So there you have a few different things that you have control over and that you don't have control over that do impact whether you get osteoarthritis of your knee. So how is osteoarthritis diagnosed in your knee? Well, it's typically done by a healthcare professional. They do a detailed medical examination. They ask you a ton of questions to find out, again, when did your pain start? How long have you had it? They do a detailed examination of your actual knee joint. They want to see how it bends, it straightens, what does it look like, what does it feel like? And then they'll usually do x-rays or imaging to see what that knee looks like and make sure there's no other cause that could be impacting your knee. I mean, sometimes there's a lot of referred pain from your hip, and then doing an x-ray can show, maybe there's arthritic changes at your hip more than your knee. So x-rays or radiographic imaging is definitely helpful in diagnosing knee osteoarthritis. A personal pet peeve of mine is, you can't unhear a doctor saying, oh my goodness, you have bone on your x-rays, or that is the worst degenerative joint disease that I've seen. I don't even know how you're moving. I personally wish healthcare professionals would kind of keep those opinions to themselves. I think it's like a self-fulfilling prophecy. Once you hear how bad your x-rays are, then your perception of pain tends to worsen. And on the flip side, there are people right now walking around, maybe in my neighborhood, that if you randomly did an x-ray of their knees, it would show severe arthritis, but they have no pain. And I think that's really important. And I don't think this video is the purpose for me to get on my soapbox about how your brain is really connected to your perception of pain. But just know that I do believe, in the minding your words as a health professional and what we say to our patients so that we don't plant seeds and make a situation worse. And you definitely do not have knee replacement surgery because your x-rays look bad. I mean, surgeons aren't going to sit there and do that. They do it based on a subjective interview with you. They want to know, how bad is your pain? What is it affecting your ability to do? What are the things that you have stopped doing because of your knee pain? I'm sorry, I've been doing this for 26 years and never has a surgeon done knee replacement surgery for severe knee osteoarthritis when the patient did not complain of pain or functional limitations. So just take that with a grain of salt. So there you have it, the 5 most common signs and symptoms that you have knee osteoarthritis. So 1, persistent pain that has gradually been worsening over time, usually for months and years. 2, stiffness, sometimes worse in the morning or at the end of the day, depending on how much activity you do. 3, swelling that comes and goes, again, based on the activity that you're doing. 4, maybe your knee is locking up or buckling when you're doing some physical activity. And 5, that crackling and popping and grinding that you feel in your knee. Now, unfortunately, we really don't understand why some people get arthritis and others don't. I mean, I've had patients that were lifelong marathon runners, and they don't have any knee osteoarthritis. And, you have some people that are significantly underweight and they have severe knee osteoarthritis. So there is still a lot of research that needs to be done, and there is no, slam dunk reason for why you have knee osteoarthritis. But hopefully today you got some working knowledge about what it is, what causes it, what to look for, and maybe even decide whether you think you have it. So definitely go talk to your doctor, talk to your physical therapist, and go get some answers.